Hello everyone, welcome back to our channel. This is Department of Anatomy, Guntur Medical College. So we will continue with the dissection video of the lower limb. In this video we will see the dissection of the popliteal fossa. So this is the popliteal fossa, this is the right lower limb. This is the right popliteal fossa. Popliteal fossa is a diamond shaped space behind the knee joint. So it is more obvious in the flexed knee. So we have now removed the skin superficial fascia and the deep fascia is the popliteal fascia. So the student should understand popliteal fascia is the deep fascia over the popliteal fossa, and they should differentiate fascia covering popliteus is different from the popliteal fascia. So now we will start the boundaries. So are you able to see this diamond shaped space? So this is the popliteal fossa. If you see above and medially, semitendinosus and semimembranosus. Above and laterally, long head of biceps femoris. Below and medially, you are seeing this is the medial head of gastrocnemius. Below and laterally, you are seeing this is the lateral head of gastrocnemius, and also so this is the plantaris muscle, and this is the lateral head of gastrocnemius. So above and medially, semitendinosus, semimembranosus. Above and laterally, long head of biceps femoris. Below and medially, medial head of gastrocnemius. Below and laterally, plantaris and lateral head of gastrocnemius. The roof is removed here. The roof is this popliteal fascia, which is pierced by the short saphenous vein, which drains into the popliteal vein. If you see the floor we can divide this into three parts of the floor: upper part, middle part and lower part. If you see the upper part, floor is the popliteal surface of the femur. So the bone is the floor in the upper part. If you see in the middle, we are not seeing this popliteal fossa is just over the oblique popliteal ligament of the knee joint. If you see the floor in the lower part, or you see this muscle, so that muscle is this. Yes, this muscle is the popliteus muscle. So there are three floor: popliteal surface of femur, oblique popliteal ligament and popliteus. So we should know the three parts of the floor, as we have one important event in each part of the floor. If you see in this upper angle of it has four angles: popliteal fossa, upper angle, lateral angle and the lower angle. At the upper angle of the popliteal fossa, the sciatic nerve which enters and divides into tibial nerve. So this is the tibial nerve, and this is the common peroneal nerve. The students can remember this tibial nerve will run in the middle of the fossa. So this is the tibial nerve will run in the middle of the fossa, as if it is dividing the lower part of the fossa into two halves. If you see the common peroneal nerve, this nerve will run as if it is not related to the fossa. It will try to run along the lateral head of the gastrocnemius and leaves the fossa. Then it will divide into undercover of peroneus longus in the lateral compartment of the leg into superficial and deep peroneal nerve. So I have covered this one content in detail, that is the sciatic nerve. If you see the next content of this popliteal fossa, are you seeing this is the popliteal vein? Yes, this is the popliteal vein next to deeper structure. So this popliteal vein is the next content. And if you see the deepermost structure, this is the popliteal artery. Popliteal artery is the continuation of the femoral artery, which you have learnt in the front of the thigh, which runs in the femoral triangle and in the adductor canal, has now entered through the fifth opening in the adductor magnus to reach this popliteal fossa. So it is medial most in the upper part. If you see in the lower part, it will come to the lateral most. So if you see the relations in the upper part of the popliteal fossa, upper part of the popliteal fossa, artery is medial, vein is in the middle and nerve is lateral. If you see in the middle of the fossa, one is one above the other. If you see in the lower part of the fossa, artery will be lateral most and the vein will be in the middle and the nerves have divided. So these are the relations of these three structures in the fossa. If you see the popliteal artery termination, so this popliteal artery at the lower border of the popliteus, to see the branches we have to remove this vein. So if you see this at the lower border of the popliteus, this popliteal artery will divide into anterior tibial artery and posterior tibial artery. So this posterior tibial artery will continue with the tibial nerve in the back of the leg, and this anterior tibial artery will enter the front of the leg. So these are the very important contents of the popliteal fossa, apart from the popliteal lymph nodes and a small pad of the fat. So I hope you should have understood this popliteal fossa in the detail. These are the boundaries. Floor we have learnt. Upper part is bone, middle part is ligament, and lower part is muscle. Contents are 3 points. So students should remember, in the femoral triangle we have learnt contents: femoral artery, femoral vein. In the popliteal fossa, popliteal artery, popliteal vein, and the sciatic nerve, which divides into tibial nerve and the common peroneal nerve. So these are the important contents of the popliteal fossa. So with the next dissection in the lower limb, we will see in the next video. Thank you.